What drew me to the MHA program was the kind of hybrid between business approach and also public health.
Being able to touch every single subject that's needed in healthcare, because my background wasn't necessarily in healthcare administration, but the program itself laid out a great foundation.
The EMHA is great because it's geared towards executive people who are already in a leadership role, like myself. So we have the experience on the ground, but this is just going to kind of combine everything into a formal degree.
I still go back to a lot of the statistics work that we did, a lot of the quality and innovation, and really another big, the big framework that I focused on a lot was really the project management offerings that the program had.
This master's program has really prepared me to be a more confident leader. It equipped me with the financial tools I needed to be successful, and also the people skills. I think a lot in my role, I'm partnering with different stakeholders and different organizations across the state, and this program has really allowed me to enhance my people skills.
And I loved how versatile that MHA program is. It really encompasses the policy side as well as the business and leadership side, and I thought I could hone in on those skills and really use them to develop and grow.
We aspire to be an equity-focused health administrative training program that's really grounded in the principles of population health. I think it's really important that we're an MHA program housed in a school of public health. It gives our students the opportunity both to learn leadership and administrative skills, but also to learn about what makes the U.S. public health system function, and to develop connections and ties with students in different disciplines who are interested in shaping the public's health, but developing similar but slightly different skills.
I really wanted to make sure that I was a well-rounded healthcare leader in my career, so that's why I picked UW.
I think what stands out from other programs, especially the faculty, is the level of experience that they have. A lot of the faculty come from quality, senior management, finances, and also technology and startups as well. So I think as you think about Seattle being fintech, it's really great that there's also finance, technology, and also your traditional healthcare experience within our faculty that they bring to the classroom.
I learned so much from my colleagues in class as well. You know, you're working with people who are in these other organizations, large and small, learning from all of these different experiences from physicians and nurses and folks in allied health services. And it really provided a different perspective for me in terms of the way that I process things, or the way that I learned, or the things that were important for me to learn versus what everybody else was learning or what perspective they had. And so that was really helpful.
I think looking at things at the whole system and kind of a 360-degree view is what was pretty critical for me here. And I think a trademark, not just the care aspect, but the cultural competency aspect of care, the ethics of it. I think that's what really stood out to me here, is that there really was a full approach to healthcare here.
The UW EMHA program has an amazing reputation in the healthcare community, and I think that speaks volumes.
I've always wanted to be in healthcare administration because I know that there's a lot of changes that I want to make, specifically with healthcare access, and seeing the needs in the communities that we were helping by opening these COVID testing sites really showed me how much need there is in the communities, so I wanted to open more doors for myself.
There is no more complex industry in all of this country than marketplace healthcare. And if you don't understand the foundational aspects of finance and marketing and strategy and process management and human resources, if you don't have that broad foundational understanding of what other people are doing in their day-to-day life that help run the hospital, it becomes very difficult to know how to make decisions, right? Because you don't understand the complexity of how those decisions are going to impact everybody else.